So in general, clinical trials are safe. Now the idea is patients who do not do well on a clinical trial are similar to patients who do not do well on treatment any which ways. That is because the cancer itself is dangerous, the cancer itself is aggressive, and at some point the cancers do not respond to the treatment. It is not the trial drug which is making the patient sick, it is the cancer which makes the patient sick. And this is true across all clinical trials. Rarely there are certain drugs which do not work as well as expected. However, all clinical trials have built-in safeguards which include things like regular checkups, regular monitoring, such that just because the trial has been initiated, if the patient is not well, there is no compulsion on the patient to continue the treatment. Patient can drop out of a clinical trial whenever they want, or they can drop out if the doctor feels that the drug is not working, or if there's an independent committee which will decide on the side effect profile of a drug and then take a call on whether the trial has to be continued. There is a lot of bad press and negativity about clinical trials in general in India, but believe me, it is not experimentation. More than 60% of cases, what trials we do are actually replicating the trials done in the West to make sure that the drug is safe for Indian population. Participating in a clinical trial gives access to drugs which are otherwise not available, and also gives access to drugs which are otherwise very expensive. So overall, it's a win-win situation for patients because they can get the best possible treatment.